Okay, so we are going to go ahead and get started to make sure we're on time here. Hopefully everyone can hear me. I'm seeing some hearts, so that's a good sign. So this is my first webinar, and I really have been wanting to do this for a long time because I just feel like there's such an opportunity for education out there, especially amongst women. And I feel like oftentimes in social media, when we're doing posts and stories, it's just very difficult to convey all this information. So I feel like this is a really great opportunity to share some free education with the community. And gut health is a huge topic right now. And it has been for a long time. And I think a lot of people have been struggling with gut issues for a while, and they've kind of accepted that as their reality when it doesn't need to be. So, the topic for today's webinar is bloating and healing the gut. And we're going to talk about one of my favorite specialty tests, which is the GI map. I talk about it quite a bit. There are three specialty tests that I tend to rotate with patients, and this is one of them. And it's actually one of the first tests I did on myself when I first entered the world of functional medicine. And I saw how much this test opened my eyes to what was happening in my own gut and really paved the way for me to come up with a proper treatment plan to start healing. So, the limitation we have with gut workup in the conventional space is typically the workup includes an endoscopy or a colonoscopy, which, as we know, are a little bit more invasive. You have to receive, sedating medications. You are put under for the procedure. And the limitation there is they are going by direct visualization with the scope. Sometimes they'll take a biopsy or a sample, but even then, unless you're taking a biopsy in the exact area where there is a pathogen, you're not necessarily going to catch it. Now, the other type of testing involves going into like a primary care office and doing a stool test there. But again, that's very, very limited because what they are testing for is a short list. Okay, so it's typically things like E. coli, Shiga toxin, salmonella, which not a lot of people have. And what they're using is direct visualization with the microscope. So if they don't see it, then they're not detecting it basically. Now, GI map is a study that uses DNA PCR technology. So it's extremely sensitive and it's extremely specific, meaning if you have an organism or a bacteria present, it's going to pick it up because it's that sensitive. And it's not just relying on visualization. So, this is an at home stool test. You get the kit mailed to your home and you send it back. And the results typically come back within 2 weeks. So, this test is just so valuable because it gives us a wide array of information that we can work off of to create a treatment plan. So I'm going to go ahead and share my screen and show you this test. So just bear with me one moment. So hopefully you all can see this here. Let's see if we can do. Okay, so this is the first page of the study. This first page is looking at pathogens. So these are those big hitters that I kind of mentioned earlier. We can see C. diff, E. coli, Shiga toxin, salmonella. Again, these are ones that we typically don't detect. I will say I've had a couple of these come back positive on maybe 2 patients. But you can see over here that this test includes a reference range, meaning if the patient results higher than this reference range, that's considered clinically significant. Now, you have to have some discernment, as the provider, because you always have to match the results with the patient. You don't want to just look at the results and miss what's happening with your patient. So, this first test, typically, if you have these present, patients are usually pretty symptomatic, they're pretty sick. The next page is H. pylori and commensal bacteria. So, H. pylori is a bacteria that colonizes in the stomach. It's extremely contagious. So, this bacteria is spread by sharing drinks, sharing utensils, kissing. It's estimated that about 50% of the population probably has this, but 90% are asymptomatic. They don't have any symptoms. Now, H. pylori can be present in childhood, and you can carry this with you through adulthood. The reason this is relevant is because H. pylori, if it colonizes too much in the gastric environment or the stomach, it begins to change the pH of the stomach, meaning your stomach is typically acidic, or at least that's what we want it to be. But when H. pylori begins to colonize too much, the gastric environment can become too alkaline. The problem with this is we need an acidic environment for a few reasons. You want acid in the stomach to properly break down your food. Now, if you're not properly breaking down your food, what happens is you start to get food that is not properly digested down into the intestines and beginning to ferment too much. And when this happens, we can start to have gas, distension, and discomfort. So, the other problem with this is your stomach is almost like the first line of defense. So, if you're eating, food that has some bacteria on it, or it hasn't been prepped properly, or even if it's prepped properly, sometimes these bugs can hang around, then you're not allowing the acid to kill off these things before they get down into the intestines. So, I typically address H. pylori when I see it. Again, it kind of depends on the patient because not everyone is going to be symptomatic. Typically, if there are symptoms with this, the patients usually will say they have acid reflux, or they feel like they're having to clear their throat when they're eating. They're maybe getting some mucus. But again, not everybody has that. These virulence factors you see listed underneath here, this study is really neat because it includes this component, and this basically tells us if they have a certain virulence factor, then this can actually be associated with an increased risk for gastric cancer and small intestine ulcers. So that's really nice that they include this, because if you're looking and trying to determine if you're going to treat the H. pylori, if you have virulence factors present, you should just go ahead and get that treated, because you don't want to increase your risk of gastric cancer. H. pylori can actually be addressed a couple different ways. The research is, there's a lot of information out there. If you put 5 providers in a room and ask them how they're going to address H. pylori, you'll probably get different answers. In the functional medicine space, I have actually seen that you can address H. pylori with herbs. Now, this is something that was told to me in my training. I was a little bit skeptical because typically with H. pylori, you go after it with 2 to 3 different antibiotics. But I tested this on somebody and actually got rid of that H. pylori with herbals. It does take a bit longer, but the benefit is you're not killing off the good bacteria with your antibiotics. So, something to consider if you have upper GI symptoms. H. pylori could potentially be a component there. Now, the next section here, this commensal bacteria, this is your beneficial bacteria. I love to explain this section because it really helps people understand why just taking a probiotic doesn't necessarily help your gut. It doesn't necessarily make your symptoms go away unless that's your problem. Now, in order to have a healthy gut microbiome, you need a rich abundance of beneficial bacteria. Now, if you're someone who hasn't gut tested and you have bloating or you have GI discomfort and you're taking a probiotic and you don't feel like it's doing anything, it's possible that that may not be your only issue. It's also possible that that probiotic may not be the strain um, or the potency that you need. So, for example, on this test, you can see here lactobacillus. That's a really common probiotic. Now, if you're taking a lactobacillus, but your lactobacillus is well in the green, it's not necessarily going to do anything for you. However, if you are taking like an Akkermansia probiotic and you're down here in the yellow or the red, or a bifido, that may be beneficial to you. The reason this section is important is because probiotics are crucial for motility. So we think of, fiber is important, to promote bowel movements, but so are beneficial bacteria. And unfortunately, with how much antibiotics are used in the conventional space, I oftentimes see patients that are deficient or depleted in their beneficial bacteria. The beneficial bacteria is also important because this is what helps guard your intestines against invaders. So you can think of these as like your army. So if you do happen to get some bacteria down into the intestines that's not supposed to be there, the good bacteria, if it's nice and robust, should come around and actually push that bad bacteria out. So if I see this section where, patients have more than half or half of these in the yellow and the red, that tells me that they are vulnerable in their intestines, and we want to address those with targeted probiotics. And actually, there's a lot of research right now out there about this Akkermansia probiotic. This is such a crucial bacteria. They're finding that this has a really strong link with immune health and autoimmune. And it's also largely responsible for helping create that strong barrier in the intestines. Little fun fact here with this bifido, that's another really crucial beneficial bacteria. You can actually boost your bifidobacteria by eating green bananas. So if you see bananas in the store that are very green, we tend not to pick those up, but grab some of those. Also, overnight oats is another big one here. This next section is this opportunistic bacteria. So this is a bacteria that if it starts to become overgrown, that can create issues. So a couple ones that I want to point out right here, the streptococcus right here. Remember how I was talking about H. pylori earlier and how if that begins to change the gastric environment to too alkaline and not acidic enough, we can have some bacteria start to colonize too much. Streptococcus is a big one here. So I often see streptococcus overgrown in the presence of H. pylori. I can also see this in patients that have a chronic use of PPIs, which are a very popular medication that's used in the conventional space for, quote, I don't know if you can see me right now, I'm doing air quotes, for acid reflux. The problem is that patients are staying on this way too long, when really it's only indicated for maybe about 8 weeks, I think 2 to 3 months at most. Because their environment is being changed. The PPI is suppressing the stomach acid, and that's making them more vulnerable for these other bacteria. So Streptococcus, Staphylococcus, these are both, if they're kept in check, it's fine. If they're kept within their range, that's fine. But when they start to become too prominent, we can start to see things like bloating, bloating with your meals, stomach discomfort, things like that, feeling like you're not tolerating your food. There's some other bacteria out in here that I want to point out, this Klebsiella and this Proteus. These are two big ones. Oh, and Citrobacter as well. These are ones that if I see them present in the gut, they come up on the stool test and they're above the reference range or close to it. These are really, these are stubborn bacteria in the sense that they create what's called LPS. And these bacteria can suppress, or not suppress, but release endotoxins into the gut. So why that's a problem is because so many of us have leaky gut. And if you have bacteria that's present that's releasing endotoxins and you have a leaky gut, then those endotoxins end up getting circulated into the bloodstream. Now, gut testing is not just important for GI symptoms. It's also, I won't hesitate to recommend gut testing for people that have like skin issues such as, eczema or psoriasis. I don't work with pediatrics, but in the clinic I work with the providers in there, I'll see them run the GI map on children because skin issues seem to be fairly common in children. And so they're often looking at the gut to see if some of these stubborn bacteria are present. I will also recommend stool testing for people that have depression and anxiety. You hear about the gut brain axis a lot. And that kind of goes back to what I was just saying a moment ago, that if you have leaky gut and then you have imbalance in your gut with the bacteria, or you have bacteria that's secreting endotoxins, those are going into the bloodstream, and the bloodstream goes everywhere, including the brain. So there's actually some research out there. We don't have time to dive into it right now, but showing some, they can't say causation yet, but some association with anxiety, depression, and some of these different bacteria. Very interesting stuff. And it actually makes me wonder how many people are, taking a antidepressant or an anti-anxiety, and really the gut's the problem. Just makes you wonder. Another interesting one on here is this Prevotella. So Prevotella is a bacteria that's actually associated with rheumatoid arthritis. So whenever I have a patient that has a diagnosis of RA, or they're going through a RA workup, or they just have achy joints in general, but no formal diagnosis, I'm testing their gut microbiome, and one of the first things I'm looking at is to see if they have this Prevotella. I do have one patient that I'm working with right now who didn't get a formal diagnosis of RA, but has all the symptoms of it. So her serum studies all came back negative, but yet, the joints are very much a problem. She did have a clinically significant level of Prevotella. So with these bacteria, whenever you see them overgrown, again, you have to take it in a case-by-case basis. I will rarely do antibiotics in this area. There are some really good herbs out there that are pretty heavy hitters. One of them is oregano oil. Oregano oil is a very strong herb. So you hear it nicknamed nature's antibiotic. And the beauty of this herb is its broad spectrum. So it goes after a wide array of bacteria. You always want to talk to your doctor before using any of these things that I mentioned, but oregano oil is so potent that you only want to use it for, I'll do it for maybe a week and sometimes cycle it, but where you can get into trouble is, taking this for months on end, because it can actually start to kill off your good bacteria. So we don't want that. This test also includes a yeast study. Candida is another one that's really stubborn. Candida can cause a lot of issues with bloating as well. And yeast can be tricky to get rid of. Candida loves sugar. So there's a lot of reasons for sugar cravings, but if patients are telling me they have gut issues and on top of that, they just crave sugar all the time, I'm wondering, do they have Candida present or do they have parasites? So really cool that this study includes the fungi and yeast section there. Speaking of parasites, this study does do a parasite workup. I will tell you, I have only seen this come back positive on one patient. And she was definitely symptomatic. So we did a combination of herbs with her. I think we did some wormwood and black cumin. We also did oregano oil with her as well. And Yeah, so it's not terribly common. I think parasites is a whole other topic in and of itself that we should save for another time. There's just so much information out there on the internet and videos, and I'll acknowledge it's difficult for people to know what to believe. You see parasite cleanses out there and such, but I will tell you if there is a high suspicion for parasites based on the patient's symptoms, and we don't have anything come back positive in this test, I will sometimes, I'll say rarely treat, but I have to feel really good about that. Again, this test is extremely sensitive because it is looking for the DNA of these organisms, but there is a possibility that, they have a parasite that's not tested for in this GI map. This next section here, this intestinal health markers, this is a really crucial component of the study. And I love that the GI map includes this because I really don't think a gut workup is complete without looking at some of these markers. So this first one here, steatocrit, this is a study looking to see how your body is digesting fat. So one of the classic signs that you're not digesting fat is that you look in the toilet and you see your stools are floating. Okay. Um, it's not always, but a lot of times that's a sign that you're not digesting fat. The elastase, that is a pancreatic enzyme. And I can tell you this is another one that I tend to see patients are not optimal with this. Interesting enough, I know I'm not the only one with this or that has detected this, but I tend to see, a pattern with H. pylori, concern for a alkaline gastric environment, and then also a deficient elastase. Those seem to go a lot of times hand in hand together, which is a double hitter for the patient because if you're not digesting your foods properly in the stomach, and then on top of that you don't have enough pancreatic enzyme, that's again preventing you from breaking down your foods properly. You're not also getting the nutrients that you need from the food either. So we can have some micronutrient deficiencies show up in our testing because we're just not able to extract from the foods what we need. So very common. If we do see a deficiency with this elastase, you can classify it into a decreased pancreatic output or a pancreatic insufficiency if it's really bad. Fortunately, now we have access to pancreatic enzymes over the counter, but there are a lot of different pancreatic enzymes out there, different strengths. Not all brands are created equal. I will definitely stress that. So always work with a provider when you're looking to address this, or if you have concern that you have digestion impairment. It's really neat because this study actually tests for blood in the stool. And why that's relevant is because colon cancer is on the rise. And although this test is not a test for colon cancer, I'll be very clear about that. You should get a colonoscopy for that. If you do see blood coming up in the stool, that is a good indication, depending on the level, to send the patient for then a colonoscopy. So I did this with one patient. Fortunately, she ended up being fine. There was no issue, but it's a good early warning sign that, maybe we need to work this up further. And again, as I've been saying throughout this presentation, is that this study is so sensitive. So even if you're not seeing blood in the stool, it can still pick it up. The secretory IgA, so this is a really important antibody within the intestines. This is responsible for maintaining the integrity of the intestinal wall. So we're going to talk about the large intestine for a minute here. By the time your food gets down to the large intestine, it's then waste, right? It's getting ready to leave the body. We don't want that waste sitting in the gut and releasing toxins for too long. And if it's sitting there for too long and you have an impaired intestinal barrier, then those toxins are potentially leaking out into the bloodstream. The secretory IgA, we want this well into the green, because that's what's going to help create that strong barrier in your intestinal wall. If we see this level low, which we're on the low side right here, this tells me that we need some immune support, and we probably need to help out the lining of the intestinal wall and work to build up that barrier. We can also see this trending low if we have overgrowth of bacteria. And what this tells me is that the intestines have been working to try to get rid of the bad bacteria, and the immune system is becoming tired. So if we go in and we help the gut out and we get rid of some of that bad bacteria, we boost up the beneficial or the commensal bacteria, and we do some other things to help strengthen the wall, such as zinc carnosine or bovine immunoglobulins. Those are two big ones that I use. We can start to see this coming up. I have tested patients that are well into the red. They're too high on their secretory IgA. And this tells me that the intestines are acutely trying to fight something. So I mentioned Citrobacter bacteria earlier, Klebsiella. Those are ones that tend to cause a lot of symptoms with patients, and it really ramps up the immune response in the gut. The anti-gliadin right here, now this isn't a test, this isn't a true celiac test, but it will actually tell us if you are eliciting an immune response to gluten. So that's really cool because for a few reasons. One, if you're someone that's eating gluten and you're not really sure if you're tolerating it or you feel like you may have a food sensitivity there, this will tell us if you're eliciting an immune response. It's also a good marker to check with someone that is completely gluten-free and they are having symptoms and they're not sure why they're still having symptoms, because this will tell us if they're actually getting some cross-contamination. And that would clue us into the need to look into their diet, where they're eating, and look at some, potentials there. Calprotectin, that's an inflammatory marker. I will say this can be helpful. It can tell us if there's a lot of inflammation going on in the intestines, but candidly, this marker has come back normal on patients where I know they have inflammation clearly by the rest of their study. So it's one marker, again, sometimes helpful, not always. So that is the test in a nutshell. This last page here, if there is H. pylori that looks like it should be treated, it automatically tests the patient's genes to see if they're resistant to an antibiotic, which is really nice because you don't want to waste your time with something that is not going to work. So I know we're running out of time here, but I wanted to share, this is a patient, a 33-year-old female who was having a lot of abdominal distension, especially right when she ate, discomfort, just having stomach aches nearly every day, a lot of acid reflux. So as soon as she ate, she was having to clear her throat. So tested her, you can see the H. pylori there. This is actually one of the patients I did herbals, and we tested her. It was about 8 months later and it was gone, which was really cool to see. Beneficial bacteria, not bad, but we can see, she's not optimal, that's for sure. So we used this section to help boost her bifidobacteria because that's going to carry over into the other bacteria. And we did that too with the prebiotics, using some of those foods that I mentioned earlier, the overnight oats, the green bananas, and doing a nice targeted probiotic for her. Streptococcus, again, probably we're seeing that because of the H. pylori, certainly didn't help there. This is important too because some probiotics actually have streptococcus in them, which can be helpful if you need it, but she's not one that needed that. She had too much. So a probiotic is not necessarily the best thing. You always want to check to see what you need. We addressed the Citrobacter. It wasn't as high as the reference range, but given her symptoms and how close she was, we did go after that with some broad spectrum herbs, olive leaf, oregano oil, and we did black cumin seed for a short period as well. Same thing down here. You can see she's pretty near the reference range here, and knowing how stubborn these bacteria are and how much they tend to cause symptoms, we hit those with the broad spectrum herbs. This patient, interesting enough, was gluten-free, strict gluten-free at the time of this study, but you can see here her anti-gliadinin came back elevated, which told me that she was getting cross-contamination. So after we dove into her diet a bit more, she was eating out 2 to 3 times a week. She was not telling the kitchen that she was gluten-free. Sometimes if you do that, they'll take a bit more precautions, but you can't guarantee it, especially in restaurants. So she was certainly getting cross-contamination, which was contributing to her bloating during meals. We also see that her calprotectin, although it's in the normal range, it's trending elevated. So knowing her response to gluten, and the fact that she ended up having confirmed celiac disease, we know that tends to be associated with leaky gut. So we address the leaky gut by doing some bovine immunoglobulins. It's actually powder that you mix in your water. Tastes pretty gnarly, but the benefits are amazing. They help seal up the openings in the intestine. So did that for about 2 months. And by the time we were 6 months out, she was markedly improved. So she reported a significant decrease in her stomach aches. I think she went months without a single stomach ache. The bloating went down nearly 75%, and we had really good results there. So that is the end of the presentation. I thank you guys so much for tuning in and listening to what I have to say. If you have any questions, I will say feel free to reach out to me. My email is bbuchanan@origo, ORIGOFM.com. My website is www.origofm.com. I do see patients over telemedicine in Arizona and in person in North Carolina. Thank you so much, and I hope you all have a wonderful evening.